name is Dr. Tahir Akhtar, and I am a clinical director in critical care medicine. Today, I'll be giving you a basic introduction to medical ventilators. A mechanical ventilator is a machine that helps a patient breathe when the patient is unable to breathe on their own. A mechanical ventilator pushes a mixture of air and oxygen into patients' lungs. Modern ventilators are complex machines and they require comprehensive training of both the nursing and medical staff to operate them safely. Here is a short film courtesy of AFP to explain how ventilators work. Patients' lungs can be ventilated either by invasive or non-invasive ventilation. Invasive ventilation requires endotracheal intubation to connect the ventilator to the patient. A mixture of oxygen and air passes through the humidifier to moisten and warm the air before it is delivered to the patient. Exhaled CO2 from the patient's lungs is removed by pushing it out to the exhaust using a unidirectional valve. This process is repeated with each breath. An alternative method of non-invasive ventilation can often be used either to delay or to altogether avoid invasive ventilation, and that is called the non-invasive ventilation. Non-invasive ventilation requires use of a non-invasive mask or a NIV hood to deliver oxygen and air mixture under pressure to the patient's lungs. Modern ventilators are state-of-the-art, sophisticated machines, a feat of modern engineering. They can provide delivery of oxygen to the patient's lungs either by controlling the volume or the pressure that is applied to the patient's lungs. We've come a long way from the mechanical ventilators of the previous century, developed because of the polio epidemic. And here is a short video.
Mechanical ventilation has been about providing life support, but we've seen in recent years that ventilation can be so much more. We know that your choice of ventilation therapy can impact patient outcome. Unfortunately, this has also made ventilation increasingly complex. You need to interpret patient data and to act accordingly. It requires your time and training, but the ICU is a complex area with lots of devices that compete for your attention, and time is limited. It's about you being able to utilize the full potential of the ventilator. Adapting the tidal volume to the patient's lung is one example. ServoU automatically calculates milliliter per kilogram of predicted body weight, supporting the ARDS-NET strategy. It is measured and trended over time. Helping you make informed decision is also a challenge because it totally changes the way you experience ventilation. To make adaptation as easy as possible, we provide you with a novel therapeutic workflow. ServoU automates calculations and helps you position the EDI catheter and to keep it in place. The ventilator also enables you to monitor the electrical signal of the diaphragm.
The global shortage of mechanical ventilators in COVID-19 pandemic inspired engineering wizards to innovate and create new designs of ventilators. Designs and efforts that range from garage-based prototypes to industrial giant collaborations between leading medical institutions and great engineering companies to produce simple yet effective ventilators. There are ventilators that can be used outside of the intensive care units, and I'll introduce you to some of them very briefly. These are the transport ventilators. They are mainly used outside of the intensive care units for transporting acutely ill patients. They are compact in design and suitable for short periods of ventilation only. Remember, the ventilators are complex machines that save lives